With the type of needle that we're using, we don't have to prep the skin because it's a monofilament needle, which means it's not been burrowed out or hollowed out. So we don't inject any or medicine with it. That's why it's called dry needling. There's the type of bacteria on our skin, both good and bad. So we don't have to prep the skin either, because when we prep the skin, we kill the good bacteria as well as bad bacteria, which creates a potential for infection. Even though these needles are so thin, the likelihood of infection is extremely low. Okay. We'll find some areas. Okay, so we'll find these trigger points. When we hit them, it'll cause the muscle to contract or cause a localized pain, and then it quickly releases. Okay, we are in an area where the sciatic nerve is. So if you feel an electrical pain that goes down your leg, please let me know, and then I will readjust my needle. Okay, the likelihood of us hitting your nerve is next to impossible, because you will be in so much pain before we get there. Okay, but the nerve does give off some warnings when we're getting close to it, and that's with those electrical pains. Okay? Any questions or concerns before we get started?
No, I don't think so.
Okay. If at any time
Any fear on that face? The face is calm, happy, nice.
I'm in
if
my
at
happy
any
place.
time you feel like we need to stop, you just let me know. Okay? So so when we do dry needling, there are three types of trigger points that we're going after. The first one is called homeostatic trigger points. There's 26 of these points throughout the human body where the nervous system and the musculoskeletal system are most intimately tied. So we go in to try to reset those areas. In this area, there are 4 of them that we're going to hit. Okay, called the supraclaneal, infragluteal, and then the piriformis. Okay, there's 3 of the supraclaneal, infragluteal, and then the piriformis. Okay, and then after that, we go to what's called the symptomatic trigger points. That's where I'm going to be feeling around and trying to find those trigger points and hitting them with the needle. The other one is called the paravertebral trigger points, right along the paraspine or the vertebra. We're not going to be up in that area. So okay, so I'm going to find this first one here. So I find the ilium, and then I kind of where the apex is, I draw a little imaginary box. I'm going to hit 3 areas within that to get this superior cranial.
So what's the diameter?
So this one is a 0.25, I believe. No, 0.3. This one's a 0.3. It's a 75 millimeter, which is about 3 inches. So we good? Okay there?
So did you feel a penetration through your skin?
Yeah,
Okay, so it's like a little
just
prick.
very mild.
Yeah.
Like a mosquito bite, kind of.
I mean, this is a very thin needle. So this one's a little bit bigger gauge than the one I was using earlier. Right, the one earlier was a 0.23 millimeter. This one's a 0.3. But a lot of that is because the higher we go, a little bit. That okay there? The bigger gauge, we need to go a little bit.
So you're just putting it and taking it out. Bam, bam, bam.
Just bam, yep.
And
So-
because he's not responding too much, it's like, whoop, that's not it.
Exactly.
Okay.
Well,
He would be letting us know.
it's not that it's not it.
We'll find those later.
We'll find those
These
ones
are
later. Yeah, these are our homeostatic trigger points. So this is, what I mean by that is this is where the muscle system and the nervous system have their most intimate connections. And so when you have an issue going on in an area, there's a trigger point, a homeostasis trigger point that's associated with that. So we go in there to try to reset it. So we're going to be going after, in just a moment, we're going to be going after the symptomatic trigger points. Okay?
Yeah, where
So
he
the way
said.
that we find the piriformis is I find the sacrum, I find the greater trochanter, come middle down there, and I find the top of the ilium and the ischial tuberosity, and get into the middle of that, and that's where we're going to hit that piriformis. Okay, I'm going to be around the sciatic nerve, so if you feel something down the leg, let me know.
Yeah, a little bit.
How far down the leg?
It's not now. I don't feel it. Out now.
How far down? To the
It's
knee?
like down to here.
Okay, so that's its referral pattern from the piriformis. Okay, that's not the sciatic nerve. If it goes
Okay.
down your leg into your ankle, that's the sciatic nerve.
Okay.
So, but this is the one I really want to hit.
Yeah, you're doing something good. I tell you what.
Okay. So I advance this one a little bit slower though, because I still am by the sciatic nerve.
How are the exercises going over this?
And this is the one you really want.
Can you you feel it letting go? Is it still tense?
Good.
We good?
I felt maybe a series of releases. I didn't feel one big.
Right,
release,
yeah.
yep.
That's
Okay.
common.
So one of the main once we hit trigger points, their body starts getting clammy. Okay, that's a autonomic response.
Cool.
One of the other things you'll see is you start seeing the redness right there. That is the histamine or histological response, which means the blood's coming to that area. We good there?
Yeah.
That's another good one.
Do you feel resistance on the dry needle?
Yeah. So
Because the
when
muscle is tight, right?
Exactly. So when I go into healthy tissue that's unaffected, it's in and out. It's
Yeah,
like a hot,
just right
hot
through it.
knife going through butter,
Uh-huh.
right? When I find tissue that's irritated or triggered, it gives me a resistance. So as I go in, kind of the thing that I tell patients is, do you eat meat by chance?
Mhm.
Okay, so a steak, when you have a steak that's well prepared, you can just cut right through it, no
Mhm.
problem, right? But when you find a steak that's not as well prepared, you have a little bit more resistance, a little more difficult. It's the same thing with the needle. When I
Wow.
find a triggered point, it'll go in, and all of a sudden it'll hit that trigger, and then it gives me resistance.
Wow, but this is a whole lot easier on the therapist's body
It is a
than
lot
getting in
easier,
there with your elbow. Because,
And more effective.
much more effective.
goodness.
So with this today,
Talk to us, honey.
Peter, with this today, you're going to want to drink lots of water.
Okay.
Okay, I wouldn't do any aggressive activities today. Walking, riding a bike easily is fine. We want
Yeah.
to clear these toxins out of there. But I wouldn't do any significant or really aggressive activities today,
Okay.
just to let these toxins start to work their way out.
Hmm.
Okay, so now I'm coming into
That's
the
a good one
TFL.
too.
And that one's going to be a really fun one. So I'm border TFL, border glutamine, glutamin.
Uh-huh.
So that was a fun one, huh?
Mm-hmm.
Over time.
So is it a similar sensation when they hit it, when we're getting the rolfing
No.
massage?
No, that's different.
Different?
So because these needles are so thin, I can generally, depending on the type of tissue, how restricted it is, I can generally get about 10 or 12 pokes. Sometimes it's a little bit less. And then my needle starts to tell me. So when I get a good needle like the first time, it goes in pretty easy. When I start getting some resistance from the skin, that tells me it's been dulled. So that's a really good one right there. So this one may dull my needle a little bit more because that's a really tight one right there.
So you're just kind of ding, 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 trying to get it to
Yeah.
go through.
I'm not trying to get it to go through, so what I'm doing is I'm pulling it out a little bit and readjusting.
Oh,
so I'm getting, with just one poke, I can get a greater surface area of the muscle. Because
Uh-huh.
what I'm trying to do with the needle is I am trying to create a response, an inflammatory response where the body brings blood and fluid to the area to heal it. So if I can get more pokes around the area, that gives me a greater surface area for healing. And I don't have to go in and out, in and out, in and out with the needle. We make one poke,
Uh-huh.
and we can hit a lot of different areas. We
How are
doing
you
okay,
feeling?
Peter?
Mm-hmm.
So on first times, I generally only do about 10 to 15 pokes. There are times when I can get up to about 40, 50, 100 pokes. For the first time, because of the type of release that it's going to do, I don't do as many pokes because I want to see how their body responds to it. A couple more here, and then I want to look at your IT band, okay?
Okay.
Tender right there.
Not too bad.
How about right there?
Not too bad. There's something there. I don't know.
Right there?
Yeah.
That might be the bottom part of the piriformis, or could be just the gluteus maximus. We good?
Yeah, that's good.
Anything down the leg?
None.
So this one's a really good one. Yeah, this one's giving me a lot of resistance.
Yeah, just a whole big knot down there. So just go ahead and do the whole enchilada.
Have you biked that? Do you guys bike?
No.
He biked 10 minutes here when we got here, but we do not ride a bicycle. Oops.
The whole enchilada. That's down by Moab, I think.
Oh.
Have you done it? Do you bike?
I don't mountain bike as much anymore as I do road bike, but I have done the whole enchilada down in Moab.
Wasn't the best time of year
It's
to
a
go?
great. When's the best time of the year to go?
Yeah.
October.
Yeah. near
late September, 1st of October. It's still warm enough. Crowds aren't as bad. That is a good one. I am sorry, sir. Did that sound sincere?
I do this for money.
Sounds like I'm getting my money's worth.
All
Yeah.
right, now I'm gonna get a different one, and I'm gonna come behind you here. Sorry.
Sure, I bet
don't
this
know.
skin is much more stiff, right? Gotta have a little.
Sometimes yes, sometimes no.
Huh.
The IT band can be a pretty ugly thing to get into because they're tight. So. And then, so this is, go ahead and just relax here. This is another trigger or homeostatic trigger point in the IT band. I'll show you my book after I'm done. So I find greater trochanter, I find lateral tubercle, or femoral condyle, sorry. And then again, just come halfway through. And then just bisect the thigh. And there we go. Yep.
Mm.
All right.
Yeah, everything's wonderful.
Because it hurts?
Yeah.
Yes, he
This one's
loves
probably-
that.
this
It's
one's probably
wonderful.
The best one right here. You are gonna feel like you got hit by a Mack truck today.
Yeah.
Okay?
Sweet, I'll get my money's worth.
You are gonna get your money's worth today. What this is going to do, though, like I said, lots of water, lots of easy motion.
Mhm.
Today you're gonna feel kind of sore. Okay.
Mhm.
Tomorrow is when we really start to see it. It should last for about a half a day, that soreness, maybe a day at the most. So by tomorrow afternoon, you really should see what this does for us. We may have to do this a few times because of how much surface area there is that's irritated.
Okay,
Okay, but I do believe that this is kind of the final piece to this puzzle.
all right.
We got the IT band to calm the, or we got the SI joint aligned. Now we just got to get this IT band,
Okay,
gluteal muscles, the piriformis muscles to calm down.
sweet.
Do you feel cold?
No.
Okay. Okay, now what I'm going to do, we're going to stay right here, and I'm going to just do some light soft tissue stuff now. Okay.
Okay.
So the needles acted as my deep tissue.
Mhm.
So now I'm just going to come in here and just get some blood flowing to the area, get the fluids, so we get these toxins flowing out.
Okay.
Okay.
What toxins? What chemicals
So
are they?
They're when you have a trigger point. So what happens is in the muscle gets its response from the brain. There's an electrical impulse that travels down the spine on the nerve to the muscle junction, where at the muscle junction there's a chemical that gets released to get the muscles to contract. On either side of the muscle, on one side of the muscle there's sodium, and on the other side there's magnesium and potassium. When that electrical impulse comes down, and where the nerve synapses into the muscle, the chemicals flow out. Sodium flows into the muscle, magnesium, potassium flows out, and that's what causes the contractions. Okay, and as long as that impulse from the brain is there, it's going to stay that way. Once the impulse is removed, then there's a pumping mechanism that pumps the sodium back out, sucks in the potassium and the magnesium, so that way the muscle can get back to its resting position or its resting state. However, sometimes those pumps can become clogged, and that's what creates a muscle knot. Okay. As long as the muscle has sodium on this side and magnesium and potassium on this side, it doesn't matter if it's receiving the information from the brain or not. It's going to stay contracted. Okay. So by us coming in doing the deep tissue, the rolfing, the needling, what that does is that creates a mechanical pressure, basically like a sponge, to squeeze out those chemicals that are stuck in that pump and allow everything to restore back to its resting position. So those are the toxins that we're talking about that are getting cleared out. These toxins they're not harmful to the body, they're just uncomfortable. Okay, and so when they've been stuck like that, they get released, they get into the blood system, the blood then takes it to the lymphatic system to clear it out. So that's what I'm talking about, these toxins. So
Okay.
it's the same thing, partly the same thing when you've done a really aggressive workout, right? You have what's called the late onset muscle soreness. This is from the breakdown of the muscle. Okay? They're not the same exact chemical, but they're along the same level. And so that's why it takes a couple of days for the systems to clear out as well. So, you going okay?
Wonderful.
That sounded almost too rehearsed.
It's true. That's what he's gonna say.
Doesn't matter.
So, because of this, I'm not going to do anything aggressive today as far as strengthening. We're going to do just get you onto the total gym, and then one other exercise for just movement, again, trying to clear the toxins, trying to create an environment which the body can heal.
Okay.
Okay? And then we will be finished for today. We may put some stim and heat on it, just to try to help calm everything down as well. So, again, tonight, if you're really sore, and you feel like you need to get your voodoo doll out, Grace Ma is my name. That's the name you'll want to use. Grace is my partner out there. So
instead of
always throw
Devin.
him under the bus.
Yeah, I got you now. Okay.
It's never my fault unless it's a good thing. If it's a good thing, that's my responsibility.
Right.
If it's a bad thing, it's
If you feel like you
My
want to have
aid
the
or
tray
my-
to toss the money in, then it's Devin.
yes, that's right. But if it's a bad thing, it's either my AIDS, it's Grace. It's a whole slew of other people that I can blame it on. Alrighty, sir. Let's take a look at that alignment now. So let's have you roll back over on your back. And I'm going to have you put both knees bent. Yep. Lift your pelvis in the air. Come back down. And let your legs come out straight. Just a little pull. Still on there. Let's see what it looks like as you sit up. Go ahead and come to a seated position. Good. Take your hands behind you and rest. And we're on there. Okay. So we didn't do any correction of the joint. Shows you what the muscles were doing to pull it out. I think that's where our problem now lies. Okay. Because even last time, even though it was out, we did do a correction. I think the muscles were really tight. So I think it's more coming from those muscles. So this will go a long way to help calm that down and start to restore your resting position in that area. I think again for as long as it's been going on, for the few months it's been going on, I think we want to hit this a few more times with needling. Okay, so let's go through some light activities today. Clear the toxins out of there. Put some stim and heat on it, and then let's see what it looks like next week. We'll get you on the schedule for next week as well.
Okay.
Sound good?
Yeah.